Hi, my name is Carla Nicole Guevara Davalos. My topic is Apixaban to prevent venous thromboembolism in patients with cancer. Definition. Patients with active cancer have an increased risk of venous thromboembolism. The Coran score identifies patients with cancer at elevated risk for VTE who could benefit from thromboprophylaxis. Apixaban therapy results in a significantly lower rate of venous thromboembolism than the placebo among intermediate to high-risk ambulatory patients with cancer who were starting chemotherapy. The rate of major bleeding episodes was higher with Apixaban.
Venous thromboembolism, or VTE for short, is a leading cause of death worldwide. In the Western world, someone develops a VTE every 16 seconds. Manifestations of the disease are deep vein thrombosis and pulmonary embolism. The disease process starts, often in one of the large veins of the leg, with the formation of a blood clot. This can be due to vessel wall injuries, a pathological increase in the coagulability of the blood, or circulation deficits such as venous stasis. The resulting blood clot consists mostly of red blood cells, held loosely together by strands of fibrin. There is a considerable risk of such a fragile clot or parts of it breaking away and traveling with the bloodstream through the heart and into the lungs. Here, the clot or fragment of clot eventually blocks a pulmonary artery. The consequence: pulmonary embolism. The affected area of the lung is no longer available for the oxygenation of blood. This life-threatening outcome can be traced back to an inappropriately triggered physiological process: blood coagulation. Various medical conditions are associated with disrupted blood coagulation and therefore an increased risk of VTE. For instance, immobilization heightens the risk of hypercoagulability of the blood and venous stasis. Patients undergoing major orthopedic surgery, such as total hip or knee replacement, have an additional risk of vascular injury.
Application in medicine. Apixaban thromboprophylaxis has significantly fewer thromboembolic complications compared to placebo. Regarding major bleeding, it was significantly increased in Apixaban in the group of patients with intention to treat.
Patients with cancer have an increased risk of venous thromboembolism, but parenteral thromboprophylaxis is not routinely recommended in practice guidelines because the absolute risk reduction is modest and parenteral thromboprophylaxis is associated with an increased risk of major bleeding as well as the inconvenience of daily injections. Could a direct oral anticoagulant such as Apixaban, used as a thromboprophylactic agent in patients with cancer, offer advantages over parenteral agents, particularly with regard to convenience? The randomized placebo-controlled double-blind AVERT trial included ambulatory patients with cancer who were at intermediate to high risk for venous thromboembolism with a Corona score of 2 or more. The Corona score has been validated to identify patients with cancer who are at elevated risk for thromboembolism. The trial patients were randomized to Apixaban for thromboprophylaxis before chemotherapy or to placebo before chemotherapy. The primary outcome was objectively documented venous thromboembolism over a period of 180 days. In a modified intention-to-treat analysis, venous thromboembolism occurred in 4.2% of the 288 patients in the Apixaban group and 10.2% of the 275 patients in the placebo group. The number needed to treat to prevent venous thromboembolism was 17. The main safety outcome was major bleeding. Major bleeding occurred in 10 patients in the Apixaban group and 5 patients in the placebo group. The authors conclude that Apixaban at the initiation of chemotherapy resulted in significantly lower rates of venous thromboembolism than did placebo, among intermediate to high-risk ambulatory patients with cancer. The rate of major bleeding episodes was higher with Apixaban than with placebo. Full trial results are available at nejm.org.
Pros and cons. Pros. The use of direct oral anticoagulants as thromboprophylactic agents in patients with cancer can offer important advantage over parenteral agents, including route of administration convenience and cons. Cons. Death was attributed to pulmonary embolism if there was no other explanation or there was autopsy or radiologic confirmation of pulmonary embolism.
I'm Dr. Gary Lyman. I'm professor of medicine at the University of Washington in Seattle. The American Society of Hematology has undertaken a very bold effort to develop guidelines across the spectrum of clinical situations where venous thromboembolism becomes a major clinical problem. ASH has decided to really reinvigorate the guideline process and to do it in what I consider the most rigorous and exhaustive fashion.
Some of the things that I think are going to be really exciting about the rollout of these guidelines are that since the last guidelines were published, we now have 4 new drugs that are available on the market for people to prescribe, and we don't have any guideline information about how to use those. And so one of the things that was really exciting for our panel is that we are able to dig in and try to make some recommendations about how to use those drugs in the treatment of people with venous thromboembolic disease. And it was really exciting, but it was also challenging because the drugs are new enough that a lot of the information about questions that people are grappling with, there might not have been as much evidence, but the really great thing is in the room in the panel discussing this were the experts and the people that really have their finger on the pulse of what's going on out there clinically. A novel thing about these guidelines is that the plan is to continually update them as much as possible in real time. And so I think our panel will get the opportunity to add additional information, and as new drugs come onto the market, there's many that are in the pipeline right now. We'll be able to add to the recommendations that we've made and continue to inform people about the optimal use of anticoagulant drugs.
Age application in Ecuador. In Ecuador, an insight of 1 per 2,000 inhabitants is estimated. The peak being a multifactorial entity, one of the main causes is the period prolonged postoperative period, presenting a risk of between 15 and 8% in patients who have not received prophylaxis, producing PE with a mortality between 0.2 and 0.9% of cases. Conclusion. In conclusion, Apixaban at a dose of 2.5 milligrams twice daily result in a significantly lower risk of venous thromboembolism than the placebo among ambulatory patients with cancer who were initiating chemotherapy and had an intermediate to high risk of venous thromboembolism. Thank you.